Type 1 diabetes or juvenile diabetes is an autoimmune disease where there is minimal insulin produced by the beta cells of the pancreatic islets. Insulin is an anabolic hormone which primary function is in the regulation of blood glucose, but besides that, it is a hormone which has a large impact on the other metabolic pathways such as gluconeogenesis, lipogenesis, and etc. Type 1 diabetes can be distinguished from type 2 diabetes through the presence of autoantibodies. An individual, if left untreated, will suffer from a myriad of health complications, but the overall prognosis is really good as long as proper management is ensured, as evidenced by the increasing life expectancy of those affected by this autoimmune disease. Type 1 diabetes can result in a variety of symptoms such as fatigue, unintended weight loss, frequent urination, increased hunger and thirst, mood swings, and etc. But these symptoms can be effectively managed when an early diagnosis is done. However, complications in an individual with untreated type 1 diabetes can potentially lead to systemic diseases such as heart disease, stroke, kidney damage, nerve damage, retinopathy, ketoacidosis, and etc. These diseases are chronic and could quite possibly last a lifetime unless proper professional intervention is taken as soon as possible.
While the exact cause of type 1 diabetes is unknown, many scientists believe genetics as well as environmental factors play a significant role. For example, human leukocyte antigens (HLA) regions have been shown to contribute 40 to 50% of the genetic risk for this disease. Environmental factors are less known, but some believe viral infections may play a role. Type 1 diabetes occurs when the body's immune system begins attacking its own insulin-producing pancreatic beta cells, leaving the patient with little to no insulin. More specifically, autoaggressive T cells, CD4+ and CD8+, as well as antibodies, recognize the islet autoantigens, infiltrating the islet of Langerhans in the pancreas. This leads to the targeting and destroying of insulin-producing beta cell populations. The most commonly found antibodies are those against glutamic acid decarboxylase, GAD, an enzyme found in the beta cells. GAD is needed for gamma-aminobutyric acid, or GABA, a neurotransmitter, production and plays a role in type 1 diabetes as a self-antigen. It is present in the pancreas and the nervous system, aiding in muscle relaxation, pancreatic functions, etc. It can also trigger the immune system to produce autoantibodies against healthy cells. In type 1 diabetes, GAD antibodies mark out pancreatic cells for attack. As insulin signals cells to take in glucose for energy conversion, the resulting lack of insulin leaves the cells with a lack of energy as well as high blood glucose, which leads to many of the symptoms previously stated.
There are several tests for the screening and diagnosis of type 1 diabetes. The positive results for diabetes in the primary screening tests are as follows. If a random blood sugar test gives a result of over 11.1 millimoles per liter on 2 separate occasions, or if a blood sugar test done after fasting overnight gives over 7 millimoles per liter on 2 separate occasions. This test can also indicate prediabetes, which increases the risk of diabetes with a result between 6 to 7 millimoles per liter. If the results indicate prediabetes, another test called the oral glucose tolerance test might be administered. In this test, you will need to fast overnight and then drink a sugary solution within around 5 minutes. Your blood sugar levels will then be checked every 30 minutes for 2 hours. This chart shows the results of this test. There's also the glycated hemoglobin test. If the result of this test gives over 6.5% glycated hemoglobin on 2 occasions, then it indicates diabetes. This test checks for the average blood sugar levels over the past 3 months, so it is also used to monitor the treatment of diabetes. If the previously mentioned tests indicate diabetes, additional tests will be recommended to differentiate and confirm whether it is type 1 or type 2 diabetes. Some of these tests include a blood test which checks for autoantibodies present in type 1 diabetes. Another test is checking for high ketone levels in urine or blood, which can also suggest type 1 diabetes. And finally, the doctor may examine your symptoms, risk factors, and family history to determine whether it is type 1 or type 2 diabetes.
Since type 1 diabetes is a chronic condition, Treatment depends on frequent monitoring and constant management of blood sugar levels. Continuous glucose monitoring may be used to make sure your blood sugar level is within your specific target range, which will be decided by your doctor. If continuous monitoring is not available, then a glucometer can be used to check your blood sugar level several times per day. Unfortunately, the only available option for treatment of type 1 diabetes is lifelong insulin therapy. This might involve a combination of different types of insulin, and the dosage will be determined by your doctor and adjusted according to your blood sugar levels. There are several options for delivery of insulin into your system. Oftentimes, you might be trained to administer insulin yourself using an insulin pen or injection. Automatic delivery can also be facilitated by using insulin pumps, which you will have to wear outside your body. It will be programmed to deliver insulin to your blood according to your treatment plan. With insulin therapy, there is a risk of improper or overdosage of insulin leading to hypoglycemia, especially if insulin is taken before a meal. Hypoglycemia can lead to serious complications if not managed properly. So, it's important to educate yourself about the signs and symptoms of hypoglycemia and also hyperglycemia. With treatment of diabetes, you'll need regular follow-up appointments with your doctor in which they will conduct several tests to ensure proper management of diabetes. Some of these include the glycated hemoglobin test, blood pressure, cholesterol levels, liver and kidney function tests. The treatment plan also involves implementing a healthy diet high in nutrition and low in fats, calories, and especially carbohydrates. Physical activity is also extremely important in regulating blood sugar levels, but the extent of physical activity should be closely monitored to see how it affects your body so that meals and insulin dosage can be adjusted accordingly. In terms of a cure or prevention of type 1 diabetes, sadly there are no known methods. But there are clinical trials being conducted to reduce further destruction of insulin-producing islet cells of the pancreas after a type 1 diagnosis.
In conclusion, type 1 diabetes is an autoimmune disease caused by the presence of autoantibodies which recognize and cause damage to the pancreatic beta cells. This leads to little or no insulin production. When there is little or absence of insulin in the bloodstream, body cells cannot take up glucose and use it as fuel for metabolism. This causes disruption in the balance of insulin and blood sugar in the bloodstream. Hence, blood sugar levels will always remain high. When blood sugar levels is high, it can produce harmful effects such as increase in hunger and thirst, kidney damage, or diabetes ketoacidosis. If an individual shows signs and symptoms, oral glucose tolerance tests can be used in diagnosing type 1 diabetes in patients. However, there is no cure for type 1 diabetes, so lifelong insulin therapy should be used for maintaining a healthy insulin level in the body. Type 1 diabetes patients should also follow up appointments with doctors regularly and always maintain a healthy diet that is low in fats and carbohydrate contents. Thanks for watching and hope you enjoyed the video.